Okay, it's 1:30. Good afternoon, everyone. Welcome to the webinar. I guess it's morning still on the West Coast, but for the rest of us, it's afternoon. Um, this is the first of a series of webinars that we've determined we should put on, trying to share best practices, especially as it relates to this COVID economy and the shutdowns and things that have happened. And the first one that we wanted to have share with us is Dr. Danny Earl. He is with Covenant Care Animal Hospital in San Antonio, Texas. We started a project for Dr. Earl a few months ago. It's a brand new 12 exam room facility to replace his old facility in San Antonio that he had outgrown. And our completion date for that project is in July of this year. So the pandemic kind of hit him right midstream of construction, and he has been extremely successful in working with curbside delivery, or as he likes to call it, concierge service. So I'd like to introduce Dr. Danny Earl. And Dr. Earl, if you could just kind of give us a little bit of a history of where you're at and your curbside delivery.
Well, Terry, you said it well. We started a project with you actually back in 2017. It started with a feasibility study that y'all did for us. It was excellent, and of course we definitely were past the point of needing a new facility, and we began that construction project last year. And as you said, it's scheduled to finish up the end of July, and then COVID hit, and it kind of put everything in a tailspin. But one thing that we've had in place in our practice for a long time is a transition team. And it's nothing more, it does include managers, but it's nothing more than a group of leaders that you recognize in your practice that can help you make changes when changes need to be made. And I think that's very important. So we met right away with our doctors, managers, and transition team to see how we could make the new restrictions that were placed on us, closing our lobby of COVID-19 work. And San Antonio was hit pretty hard because you may remember we were taking in cases from COVID cases from cruise ships and from other countries that were flown in. And so things closed down here pretty quickly. And so with that, we realized that if we wanted to maintain our current level of revenue, or possibly even increase that, we were going to have to change things dramatically. So out of those meetings came some pretty successful changes for us. The first thing I would say is just recognizing that you have to do everything curbside. That really changes things because your lobby is no longer a lobby where clients are going to come in. It's a makeshift, all of your exam rooms become makeshift treatment rooms, and that's very important to understand. So we're in a shopping center now, and all of the other businesses in the shopping center are closed, so that opened up quite a few parking places for us, which was very vital to maintaining our viability. So we marked every parking place, which is important. You have to know where clients are, and two of our receptionists and our greeters are actually out in the parking lot, and as clients pull up, they're able to check them in on tablets. Our Wi-Fi reaches out in the parking lot. They're able to check them in on tablets, which then prints a check-in sheet or alerts the staff that an appointment is there. Those people also have radios, and they radio the staff that an appointment is there. So we were staffing up for the new clinic that we're going to move into prior to this happening. And so that's really helped us a lot because curbside service does take more people. However, I think it can still be done very efficiently. So what we do is each doctor is assigned a room, an exam room every day, and we stay in those exam rooms pretty much all day. They're also assigned a technician, and they're assigned a runner or technician assistant. And a runner does not have to be a highly trained individual. A runner is simply to run out and get the pet and the form of payment from the client. And so when a client pulls up, our greeter greets them. They check them in. They put a sticky note, a large sticky note with the time they checked in on the car's windshield so that that's visible to the greeters, because they have to be cognizant that if something is not happening within a few minutes, they have to check on that client. and see why it's not happening, or check on us and see why it's not happening. So as soon as we get the call, there are appointments there, our runner goes out to get the pet. And while that's happening, our technician's on the phone with the owner. So the runner gets the pet, the credit card, and a viable phone number. The technician calls that owner and gets a history. While they're on the phone with getting the history, my runner holds my pet for me while I'm examining it. So I'm actually examining the pet while my technician's getting the history. She gets permission to do whatever treatments that she thinks we may need to do, and that, or she may ask, hey, this is what's going on. What would you like to do? Whether that's x-rays or labs or whatever. And we work on that. And then the doctor will call the client with those results. And, we can, for most appointments, we can get that done within 30 minutes. For some, we ask owners to drop off. But we call with the results. We talk about what needs to be done, talk about the treatment, talk about what we're going to send home with them, why we're doing what we're doing, what's wrong. At that point in time, I turn it back over to the technician. The technician checks the client out. In the room, we have portable credit card processing machines in the room. The client checks them out. The runner takes the pet back with any medications or whatever needs to be done. If something has to stay, if something's sick and they have to stay in the hospital, when the doctor makes the call, they would go over the estimate with the owner of what would need to be done and what the prognosis is and how long the pet may have to stay, etc. And I will tell you that for the most part, I think the clients are very, very happy with the service. They're very appreciative that we're open. We've been an essential service since the start. And although our lobby has been closed, we've been able to maintain and actually greatly increase our revenue during the COVID crisis. So it's been challenging. For me, my personal why is helping people. And so I miss seeing the people in the lobby. A phone call to me is not the same as a face-to-face conversation or even a Zoom meeting, but it is working out well for us. One other thing I would say is that you have to be careful not to tie up all your clinic phone lines. We have issued 6 different clinic iPhones that our staff uses to call back and forth to clients, and the doctors sometimes will use their own phone or a clinic phone to call clients as well, because those incoming calls just really have increased for us a lot during this crisis. So.
Yeah, I think Dr. Earl, when we talked last night, you had mentioned that you felt pretty fortunate that you had already started staffing up for the new hospital. So you already had some of that additional staff that was required to be able to effectively do curbside medicine. And whether that was just luck or however, and as we talked, in difficult times, a lot of times the first reaction is to cut expenses, cut staff. And from what you've explained, that it would not be possible to effectively do curbside delivery with a reduced staff, and in fact, you require more staff.
It does require more staff, and the good news about that, though, is that as far as the runners go, they do not have to be highly trained. Basically, they're just running out there, getting the pet and bringing it back in. Mm-hmm. We're fortunate in that over the past, the 2 months before COVID hit, we had hired 8 new team members, and they were in the process of training. Now, it has really put a damper on our training for the new hospital, but but we had bodies to throw at the problem, and I think that is a key element. And you make a very good point in that it does take more people. But the interesting thing is that for us, we're seeing more people because a lot of veterinary hospitals aren't able to maintain their normal schedule with this. In fact, they're seeing half as many patients, or some of them may be closed for certain hours during the day, and we're really being inundated with new clients. Our new client numbers for March and April were up over 100%, and that's holding right now in May as well.
That's amazing.
Year over year. And so actually in the midst of all the chaos, there's a tremendous opportunity for clinics that can do this efficiently.
Yeah, and you mentioned efficiency. Your efficiency ratios are something that you've been studying, and you found that even with the additional staff, your efficiency ratios are at least holding.
Yes, they are. It's a calculation that we do on a monthly basis, and basically taking the hours worked, your gross revenue divided by hours worked, and seeing how many hours worked it takes to generate every dollar of revenue. And that's been holding very steady, and that's because of the increase in revenue that we've had since this started.
Excellent. And as we look at that, I guess I should maybe back up with something I should have covered before we started. If you look on the bottom of your screen, there's a Q&A button, and you can post any questions there if you have questions for Dr. Earl or myself, and we'll answer those questions as we get to them and have time. So please feel free to post questions as you have them. As you know, we've learned things from this COVID environment. One of the things that we're studying at TWC is what effect long-term in the post-COVID environment are we've learned a lot of things, some pleasant, some not so pleasant through all of this, but some of these things I think are going to continue on in the post-COVID world. What's your view of that, Dr. Earl, as far as telemedicine and curbside delivery, and maybe even, I think you talked about it a little bit, in that you are practicing some telemedicine with curbside delivery and talking with the clients while you're seeing their pet?
Well, those are all great questions, and honestly, those occupy a lot of my what little brain power I have left these days. And those are our current meetings with our transition team, because I think curbside is not going to go away. I think there will be some subset of our client base that's going to want to always have this type of curbside valet type service. That may be due to fear of being around other people, and may just be due to convenience. One thing that I'd shared with you early on in our project is that I've always envisioned people paying online and picking up their pets and us running them out to them. But I never envisioned having a full curbside service like this. And it does produce some challenges, which are nothing more than opportunities. For example, right now, if we had to open our lobby, I don't think we could do that at a 50% or 25% or 50% basis, because you would have to reserve, in the facility we're in now, you would have to reserve some exam rooms to see clients and some exam rooms to do curbside, or do curbside all in the back of the house. And that makes it a little tougher, because those spaces back there are limited right now in our facility. They won't be when we move into the facility that you're building for us. But I can tell you that it is going to change things, and I do think that people are going to want to continue this type of service at some level in the future. And so I discussed with your partner and with you a little bit about it may actually change the future design of some veterinary hospitals too, where you could have some makeshift treatment rooms, maybe not a full treatment room, but a larger exam room in the front part of the hospital, as well as regular examination rooms. And the treatment type rooms could accommodate the curbside service a lot better than a makeshift exam room / treatment room could. That may be something that, like you said, is here to stay. As far as telemedicine goes, there's a few platforms out there that are available. AirVet, we basically just been FaceTiming clients for our telemedicine, and we have not used a lot of it, but we do use that sometimes for surgical rechecks, for things like that, medical rechecks when patients are doing well. When an owner thinks a patient is not doing well, we try to get them back for a medical progress exam, in the hospital. I think, telemedicine and veterinary medicine is going to have its place. Some of this we've been doing for years. We've been consulting with clients over the phone for years and not monetizing that. That's a whole nother issue, is how do you monetize it. But for the most part, our patients can't talk, and it's very hard to replace the hands-on examination when you're looking at patients. Like many other veterinarians, there's been so many things we picked up just on wellness exams that were serious issues, splenic tumors or cancer or whatever, that owners never even noticed. And it'd be a sad day if you missed that on a telemedicine exam.
Right.
So.
There's a question posted, and we actually talked about this last night as well. The question is, are you planning to open up in the near future to allow clients to come into your facility for face-to-face exams? And if yes, are you doing this on a limited capacity? And what is your plan to facilitate that?
Yeah, so that's a great thought. So our plans right now, I met with a group of veterinarians last night to discuss this very thing. And if I had to do it right now, my plan would be to wait until we could be 50% occupied, and we would still have owners wait with their pets in the cars until the exam room was open. And then our technician or runner would come out and get the patient. They would bypass the lobby. They would walk through the lobby, keeping social distancing in mind, but go directly into the exam room when it was open. And that's how we would make that work, and that's how we're going to try to make it work here in the next couple of weeks when we go to 50% here in Texas. We're 50%. It's funny, we're 50% in restaurants, but not other businesses yet. And so I don't think it's worth the effort to do it for 25% capacity. But when we hit that 50% mark, we're going to try to reserve some exam rooms for just exams. And we're still going to have owners wait in the car until their exam room's open.
Great. Another question, do you know if there's a ratio of parking spaces needed per exam room? And you had mentioned that the retail center that you're in now was closed, which was a fortunate circumstance for you in that you needed more parking in order to do curbside delivery. Any ideas as far as kind of a ratio?
Yeah, I look at that, and it's somewhere around 2 to 2.25 parking places per exam room that have to be available. And that's, we currently have 8 exam rooms, so we're looking at about 20 spaces, and we do utilize about 20 spaces throughout most of the day. So you can imagine how it looks. It's chaos under control. It's our runners our greeters are running around the parking lot. It's 100 degrees here today, so you can imagine what that's like. We have runners running pets in. It's amazing to me that people don't mind giving us their credit card when they give us the pet. They just hand it right over and trust us with that. So that's been very beneficial. The amount of cash transactions for us has always been about 6% of total transactions. It's dropped down to about 3% now since this started.
Well, the mobile credit card option would be just another, I guess, delivery for the client to be able to run the credit card right in their car.
Sure, absolutely. And we have those. It works out better for us. So our runners are technician assistants, and I think it'd be a little taxing for them to run the card. It wouldn't be that difficult, but I think there's fewer mistakes when the person running the card is in a quiet exam room after the pet's left, talking on the phone. Just human nature.
Yes. Anything else that you see as far as what you're anticipating the post-COVID world is going to look like as it relates to veterinary medicine?
Well, I think that it will be different for a long time. I really do think that it's going to be this hybrid of patients, clients in the lobby, and curbside service. I don't know how comfortable people will be in a small exam room, if your exam rooms are small, with a doctor and a technician in there. And I think we'll have to be cognizant of that. I think we may have to offer clients to wait wait in the lobby if they're uncomfortable, or wait in their car, or something like that. I don't know. I don't know what it's going to do to the labor force. Prior to all this hitting, it was labor was getting pretty tight.
Right.
Low unemployment is great until you're trying to hire people, and
Yeah.
and so labor was getting kind of tight, and that's why we started hiring early, because when we would run across a good person, we would just hire them. And I'm all about efficiency, but I'm also about doing a good job and training. And so we put this phased training program in place prior to all this happening, to enable us to train people in a more expediently and more thoroughly, and everybody being on the same page. And that really helped us too, because our trainers are really good at going through the training with people in a pretty pretty concise manner with every person. So whenever this does break and we can get back to the training, it won't take long to get people trained up.
Good. Are there any other questions out there? I think we've answered what we've had so far on as far as questions. Oh, we just got another one popped up. Do you envision having to provide more protection for your receptionist if you open your lobby similar to Walmart's?
I do. We're trying really hard in the vision for the new practice, especially, and even now, to take as much pressure off the reception counter as we can, as much traffic off the reception counter as we can. So our new hospital has a call center. There are 4 stations in there. We do that now in our current hospital, and it's amazing if you can have just 1 or 2 people just dedicated to answering the phones, how much pressure that takes off. And also checking people out in the rooms, in the exam rooms, using the technicians. We can socially distance 6 feet away from people and check them out in the exam room. You can do that on the counter too, but it's a little awkward. And basically, we want our receptionists to engage with people, eye-to-eye contact, walking around the lobby, that kind of thing. We don't want them restricted by a desk. And so that's just how we do things. It's all about relationships. And so the answer is I'm not going to provide shielding for them in the lobby. They can maintain their social distancing in our lobby now, and they sure can in our new lobby. And so, but I am doing everything I can to pull required interactions, face-to-face interactions, off of their hands.
Yeah, I do see that's going to be an issue as far as the relationships and building relationships when, now during COVID, we're putting all kinds of barriers up. We're putting plastic shields up at every cash wrap, and people are hidden behind masks. And so it is, building relationships is going to become even more important because people are really looking for the relationships. They're feeling very isolated today.
Yeah, Terry, and that really speaks to our mission. Our mission simply states that we celebrate the precious bond that people have with their pets through exceptional relational veterinary care. And I always tell people we celebrate that bond, we celebrate the bond we have with them in this relationship. And since that's the whole purpose behind the change of our name from APC to Covenant. We call it a covenant that we make with people, a relationship, And so it is huge, and people really want to be cared for, and they really do seek that relationship. And like you said, it's probably going to be more critical during COVID and post-COVID than maybe ever before. And I think clinics that can build a culture around that are going to do pretty well.
Yeah. Good. I don't see any other questions that have popped up. As I mentioned earlier, this is the first of a series of webinars. Our next webinar is going to be on telemedicine. We're going to have Dr. Matt Silvius from Eagle Animal Hospital in Kansas City, Missouri. They have been very successful in getting telemedicine up and running within their practice, and we have another project coming up with them as well in the future. So anyone that has attended this, we're going to be getting you an email with a link to get to the recording. We ask you to feel free to share that link with others that you know might be able to benefit from learning more about curbside delivery, as well as if you would like to contact Dr. Earl with any questions, we will get you his email address as well so that you can contact him with any more specific questions. So if I'm not seeing any other questions, I think we can wrap up for the day. Thank you so much for your time, Dr. Earl, and your willingness to share with us. It's you've been very successful in a very quick transition into curbside delivery, and I like the fact that you like to call it valet or concierge service because it sounds a lot better than curbside delivery.
Well, thank you so much for having me. I really appreciate being here.
All right, excellent. Thank you. Have a great day, everyone.